Hey Joey, great to connect with you. Welcome to the podcast. How's your
Awesome.
Friday going?
It's going good, man. Super excited to connect.
Yeah, same here. Same here. So for anybody that is listening to this or watching this, and they're like, "Who's this Dr. Joey guy?" Could you tell us a little bit about yourself and what you do?
Yeah, absolutely. So I'm Dr. Joey Seyforth, owner of Combat Performance and Wellness. We work online for shoulder rehab with people all over the world. Background, I'm a doctor of physical therapy, strength and conditioning specialist, and also a certified athletic trainer. So I've worked with a variety of patients ranging from, youngsters in high school to people in their 60s and 70s dealing with shoulder pain.
Awesome. Well, let's jump right in. So, shoulder pain seems to be something that almost everybody deals with. And why is shoulder pain so pervasive? Why is it so stubborn to get rid of?
Great question. So, number one, the shoulder can be a complex joint depending on how you're looking at it. Traditionally, when you're thinking about other joints like a knee or an elbow, right, you have a hinge joint. So, it kind of flexes and extends, and that's about it. The shoulder, being a ball and socket joint, it has to move in a lot of different directions. And with daily life and sports and positions we put it in, you have to have the mobility component so you can actually get into these positions, but then you also need to have the stability side of things to be able to do these activities without flaring up pain. So I think a lot of times in healthcare, people put, different, individuals with shoulder pain in these certain boxes and these same exercises. So everyone gets put in the same path. So I think that's the common stuff that we see with a lot of shoulder people.
Okay, so there's not a one size fits all approach. Um, it's interesting because I've had shoulder issues flare up over the years. My dad has. I have a lot of friends where their shoulder is their weak point. Um, why is it so hard for people to find lasting relief? Why is it that just a couple of exercises done in a short period of time don't solve it for us?
Well, I think people kind of fall into a couple different buckets here. So traditionally, the model was rice, right? If you have any pain, rest it, ice it, compress it, elevate it, and don't really do too much with it. The new model of thinking now is showing that that's a problem because I'm going to show you an example. Let's take Steve. Steve is working out, he's staying active, he's having shoulder pain. He goes to the doctor, they inject him, and they tell him to stop doing those activities. So he takes a couple weeks off, feels better, gets back to the gym, flares up the shoulder again. So a lot of people they stay on these cycles because they're either doing too much of the same movements and not exposing the shoulder to different positions, or not training in a way that bulletproofs the shoulder for those activities.
Okay, so y- you've been a personal trainer, certified strength and conditioning specialist, and yet you specialize in shoulder pain. I'm curious, like, what sparked your passion for that? Why have this be the focus of your career?
Yeah, so I had shoulder pain for 5 years, and this goes back to when I was like 18 years old. I remember, dealing with some stuff here and there. Went on to college, and it kind of stayed around. And then I also had it when I was in physical therapy school. So the help that I was getting was from a variety of people over the years, right? I've had dry needling done, I've had Graston, I've had cupping, I've had hands on, I've had physical therapy. And it seemed like every single person would give their take on what I needed, and it always would contradict other things. And then when I was on my year 4, year 5, I remember seeing local physical therapists. One told me to stop sleeping on my left shoulder. So I stopped sleeping on my left shoulder. Another one told me to stop pressing above my head with different exercises. So I stopped doing that. Then they told me to stop doing push ups and even bicep curls. So if you know anything in fitness, there's really not much you can do if you can't do your shoulder for your upper body. So I just stopped working out. And at a certain point, because I was in physical therapy school at this time, there was a certain point where I just kind of looked in the mirror. I'm like, I need to figure this out. I'm 23, dealing with this shoulder pain. Like, this is not normal. So I kind of made it my mission to figure out what was needed, doing some research, finding the best exercises, and then figuring out what my body really needed. And once I had that, the rest is kind of history.
You'd mentioned microneedling and a couple of other things. Are those, for anybody who doesn't know, like what are those treatments and are they just treating like the symptoms of the pain, not the underlying cause? Like what's the difference?
So this is what I would say. I would put like, needling, acupuncture, massage, anything soft tissue. I think it goes in a specific bucket. And you always need to know the goal of what you're trying to achieve with a modality. If you're doing dry needling on somebody's shoulders and you can calm down their pain for 2 to 3 days, double thumbs up. That's a big win. Same thing if they get a massage. The problem is, what are you doing now with your body to improve the healing side of things and get you back to your activities? So there needs to be that gap that's filled. If people are only doing massage, only doing needling, only doing stretching, you're going to calm down your symptoms. But when that window closes and the pain comes back, there's always the what's next factor. And that's where we really step up and try to meet people where they're at and where they really want to be with their shoulder goals.
Love it. So you mentioned earlier you had an experience where you went to different doctors and you got conflicting advice. Um, I think most people listening feel that happens all the time. So,
Yep.
what do most doctors or PTs miss when it comes to treating shoulder injuries?
They slap an MRI or an X-ray up on the screen and tell somebody how bad their problems are without addressing how they're moving and getting into various positions. For example, if you have somebody that has a rotator cuff tear, they go in, maybe they weren't really experiencing too much pain, and something happens. They bench heavy, they land on the shoulder, they throw a ball, whatever it is. They go to their primary provider. Hey, let's get an MRI, let's take a look at it. You have a rotator cuff tear. So they're either going to inject it, they're going to schedule a surgery, or they're going to put you in the physical therapy route. And now this person has this label that they have a rotator cuff tear, arthritis, impingement, and now they take that fear with them through other parts of their life. So I think what a lot of people kind of fall into is traditional medicine doesn't match the person where they're at and what their body really needs to get to like that next level. It just puts everybody in the same box. You have shoulder pain, whether it's the physical therapist or it's the healthcare provider that's doing the MRI with it. It's the same sheet of exercises. So people just stay on this same train of just doing the same monotonous things over and over and not really addressing their movement faults.
So, the hamster wheel approach, you just get
Yep.
stuck on that.
Yep.
So, how is it different with you then? So, when you connect with a new patient, what does that assessment look like? Because you do this pretty much remotely. So, if
Yep.
I'm coming to you, what does that first meeting look like for you to determine something custom for me?
Absolutely. So we always have an initial like discovery call with our team, asking somebody about their history, things that they've tried, screening for any yellow or red flags to refer them out to somebody else to get like maybe it's like an imaging or we think that there might be like an infection or something that's like not being addressed. Then they get on the call with like one of our shoulder specialists here. We're reviewing their history, understanding their goals, looking at everything that they have tried so far to make sure what we're doing could be potentially something that is missing. Once we understand their background, we then move into the assessments. The assessments are looking at 5 specific areas of what can impact how the shoulder moves, functions, and is able to get into positions. The first area is the neck. Second area is going to be the thoracic spine or your upper back. Third area is going to be the shoulder blade. Fourth area is going to be the shoulder, which is a ball and socket joint. And the fifth key area is going to be any nervous system component or nerve tension. This component right here is 70-75% of people that are reaching out. They're having pain sleeping at night. Their pain can vary day to day, and it's moving to different positions. We specifically screen nerves on that call, looking to see if there's any involvement from the neck or the nerves that's also leading to their shoulder pain. So we call that our Big Five system.
Okay, and you just sort of do that by having them do certain movements, and then you are able to figure it out. Okay.
Exactly.
Okay. So you've worked with all these people all over the world. I'm sure that there's one or two stories that really stand out to you from somebody who was maybe really messed up or made a really huge turnaround. What's one story you could share with us that still gives you chills?
Ooh, I'm getting goosebumps just kind of thinking of a couple of these here. I'm gonna go with Tom. So Tom is a 62, 63-year-old. When he came to me, he was dealing with shoulder pain for 20 years. He saw every person under the sun, multiple physical therapists, strength conditioning coaches, but he still was having pain with bench press. The strength conditioning coaches were telling him to push it under the barbell, and the physical therapists were telling him to avoid that movement because it was quote unquote bad for his shoulders. When we started out, he was hesitant about the online side of things. How are you going to be able to fix me without putting your hands on me? But he was bought in. 12 weeks we went through and we worked through everything, got him back to bench pressing heavy. In July 2025 of this year, he got the bench press world record for his weight class. He put up 347 pounds at a 90 kilogram body weight and is now the record holder for his age and weight class. When we first started, he was having pain benching 135 pounds. So, and also having pain with sleeping at night. So, to take somebody that was having pain with some of these basic activities, getting them out of pain, and then being able to build up that strength over the next 4 to 5 months with it to get into where you need to be, that was a really cool story.
That's insane too, to be dealing with something for 20 years
Yeah.
and then to not just say, okay, I'm pain free or I have relatively good movement, but then to be that strong, that's a pretty dramatic swing.
Yeah.
So you mentioned that there's the 5 point assessment you do.
Yeah.
Um, what's the most surprising non-shoulder thing that causes shoulder pain that would maybe shock some of us?
Nerve tension coming from the neck or the first rib. So traditionally on our calls, we will go through shoulder assessments and we'll screen all five of those areas there. Then, depending on someone's presentation, we will give them an exercise or a treatment. We will then retest to see how the shoulder responds. A majority of people that reach out, we are not giving a shoulder specific exercise on that call. We are either giving something for the neck or their first rib and retesting. We've had people that have gotten anywhere from 20% improvement after doing an exercise to upwards of like eliminating their pain completely. If we see any change, and this is the part that really separates it from traditional medicine, if we see any change, that tells us we are dealing with something higher up that is referring into the shoulder. That then gives us the roadmap or where we need to start from a treatment side of things and rehab. And oftentimes, this banded ER, IR, the little pulleys and doing these little wall crawls up the wall, I can't tell you the last time we gave any of our clients any of those exercises.
Well, it's got to be exciting for them to feel like a lot of the podcasts that I do, practitioners will say that a lot of their patients feel gaslit, that they've gone to doctors, they've gone to other therapists, and feel like, well, we're doing all the right things and like there's no answer. So to have something that is custom probably feels really good, and that first meeting starts to alleviate the pain feels like, okay, we're on the right path. Um, you mentioned sleeping positions. That was something one of your a past PT had shared with you to not sleep on. I think it was your left side.
Yeah.
Um, I think you mentioned that the neck or nerve stuff or neck stuff, it could play a role in it. Um, sleeping positions, do they inherently cause pain? Should people not sleep on their side, or is there more to it?
So what I will say is there's a lot of talk out there on the internet and also in the health world of the best quote unquote sleeping position. And what we tell all of our clients, the best sleeping position for them is the one that they get the most comfort in sleep in. So whether that's on their stomach, on their back, on their sides, if we're telling people that a position is bad, we're not doing our due diligence as a healthcare provider. Because think about what somebody's doing in bed from 6 to 9 hours, and think about the other like 18 to 20 hours that they're doing outside of bed. That's what we need to focus on with it. If somebody's having pain laying on their side, for example, we need to understand why. Is it a nerve compression issue? Is it the shoulders flared up from doing too much stimulus throughout the day? Or is it the shoulder can't really tolerate that position? Once we understand that root cause behind it, we know the specific game plan for it. So a lot of our clients, 80% plus, have pain with sleeping at night on their shoulder. We provide them nighttime routines to get them sleeping better throughout the night. And oftentimes it's not like, hey, I have pain and now I don't have pain with sleeping throughout the night. Now you got Stephanie who's getting woken up at 2 o'clock as opposed to 11 o'clock the night before, the day before. Then that 2 o'clock turns to 3 o'clock, 4 o'clock, 5 o'clock. Then they're sleeping throughout the night. That's where we're really big on monitoring how somebody's responding on a sleep basis and also everything that they're doing out of the bedroom with it. And then that's how we really devise the nighttime routines for our clients.
That's awesome. So, okay, so if I'm stepping back, um, as I was getting ready for this interview, I
Yeah.
went into social media and was looking at a lot of comment sections related to shoulder pain.
Yeah.
And one that came up a few times, and I think it happens to all of us, is sometimes as we move our arm around, our shoulder will pop or click.
Mhm.
Um, is that common? Should I worry? What are your thoughts on that?
Yeah, so I'm a big analogy guy. So I'm gonna use this analogy here, and then I'll connect the dots. So if you think of a train on the tracks, right? You got everything centered, and then you have the guardrails on the side. If we're moving like to our body's best ability, we're gonna stay centered. If not, and we're on this train, we might veer off, hit a bump, and then self-correct. The same thing is happening when somebody's doing popping or clicking. Popping or clicking can be tendons, it can be ligaments, it could be fluid, or it could be muscles that are in the shoulder. What we tell our clients is not all popping and clicking means something bad. But if you do land on it or you do something and there is severe immediate pain, that's going to be a bad pop or click. But we don't scare our clients in saying that that's bad. They should avoid something because they feel popping and clicking. We take a step back and improve how the shoulder and shoulder blade are moving together so that way you can reduce that popping and clicking.
Okay, so my arm's not going to fall off if it pops or clicks every now and then.
No.
Okay. From so it's you take things from a very holistic standpoint, not
Yeah.
necessarily just here's a sheet of exercises, go do them. Um, but I'm also thinking about people who have trouble sleeping. I know lack of sleep can lead to cortisol levels rising and a lot of stress to the body.
Yeah.
You'd mentioned, okay, sleep obviously is a big thing, but that's maybe 8 hours of the day. What are they doing the other 16 that could be aggravating that? What daily habits are quietly wrecking our shoulder health over time?
Not so posture is a big thing that comes up, right? Everyone's like, you got to have good posture. Every person who hops on these calls, I know it's because of my posture. I know it's because of how I'm sleeping. And I like to challenge people in a friendly way. Let's say somebody gets on the call and they're like, yeah, I've had shoulder pain for 6 months. I know it's my posture that I'm dealing with at work. Okay. How long have you been working that job for? 10 years. Okay. But we've only had shoulder pain for the last 6 months. Is it fair to say that there's maybe other factors that are leading to why they're having that shoulder pain in the first place? Yes. Same thing with sleep, or same thing with everything else. The big problem that people run into is they don't. I'm trying to think of the best way to phrase it. Your next posture is your best posture. That's what we always tell our clients. If you're doing a lot of sitting, stand. If you're standing a lot, sit. If you're hunched over like this, get the shoulder in extended positions, because at the end of the day, if you don't put your shoulder in those positions, it's not a matter of if, it's just a matter of when. And if you're not used to getting into that spot, you add some weight, you add an activity onto it. That's where people run into these flare up states over and over with it.
So let's go back, I think, a little bit to shoulder mechanics.
Yeah.
Um, is something that for me as a wannabe physical therapist at one point in my life, I find really fascinating. And I think to a lot of people, they'll hear things like winging, or you mentioned how the scapula is sitting, and they'll think, what the heck? So let's say that we hopped in an elevator together and we got to ride it up to the top floor, and you had 60 seconds to kind of re-educate me and the listeners on shoulder mechanics. In short, what would you say?
I would say you have to address the shoulder blade. The shoulder blade is the foundation for what the shoulder sits on, and it's neglected heavily in the traditional medical model. People get these exercises to bring their shoulder blades down and back, which is great. And I tell clients it's great if you're going to be doing a basic banded ER, IR at your side. or you're chopping vegetables in front of you. But the reality is, a lot of people are limited and they have most of their pain when their arm is above 90 and going overhead. So, one thing that we see with our clients is by giving them exercises to get the shoulder blade to now move up and around, it clears that space for their shoulder. Now they have more breathing room, they have more mobility, and now they have more confidence to get into those positions overhead. Then once they have the confidence, the foundation's built. Now we have to just bulletproof it and get it strong through all these different ranges now.
And ER and IR are is external rotation, internal rotation?
Yep, the classic PT 101 right there.
Okay, okay. So, um, people struggle with shoulder pain so much. And one of the defaults that I hear a lot is pain medications,
Mm.
taking Tylenol, whatever, right? Um, what's your take on them for ongoing issues? Like, where does it help? And then where does it cross over and actually start to impede recovery?
Number one, I would say a lot of people that reach out to us are not dealing with just inflammatory pain. They're also dealing with nerve pain. So if you have somebody who's taking Tylenol to sleep throughout the night or to do these different parts, and they said it maybe lowers their pain a little bit, but doesn't completely remove it, it's likely because they are also dealing with nerve pain. Tylenol is an anti inflammatory for muscular conditions. It does not touch nerve tension. So number one, I'm not really a big fan of using any type of like medication with it because number one, it's going to mask your symptoms, and two, pain is your body's way of telling us that something is not going on the right way. So it's basically pumping the brakes for the system and telling us that we need to focus on why that is.
Okay, and I get that. I'm wondering though, because sometimes there will be pain that is quote unquote good pain that we need to push through. And then
Yep.
other times it is that warning system that we need to pump the brakes. So, how do you know when pain means stop and pain means keep moving, but move carefully, maybe?
Love this. So this is something that we use with all of our clients, and it's called a traffic light system. So this is my crappy version of a traffic light, but if you imagine a little traffic light here, there's three zones that your body is going to go into. There's going to be a red, a yellow, and a green zone. So a lot of people, they're told if they have pain to just stop, kind of like what you're saying there, and then they have other people that tell them to push through the pain. The way that we're monitoring with clients is we teach them this system. Let's say, for example, you're going and you're working out. You're training in the yellow. You have low pain levels. It's not spiking in between sets, and you're able to work up to a certain weight or capacity. That night or the next day, your pain levels spike. You can't sleep throughout the night. It's aching, it's throbbing, it's in a flared up state. We have our clients message us because we have to figure out everything that happened that day that could trigger it. Is it our exercises that we're prescribing, or were we doing a little bit too much in the gym or certain activities? That way, by using the traffic light system, it allows us to test and get new baselines throughout the process with things. So if you train in the yellow, you feel pretty good, you sleep well, and you're recovered the next day, all those movements, all that stimulus you did in your workout, double thumbs up, you're able to continue doing that. But if it spikes you into the red, we need to figure out if it's a stimulus, if it's a load, or an intensity issue, and focus on those key pieces to keep somebody training.
I love it. I'm gonna be thinking of your traffic light anytime I work out. So, um, I'd like to get your take on cortisone shots. We were talking about pain management. Already, you had mentioned you're not a huge believer in medications for symptoms because it could be masking other things. And I think about professional athletes where a lot is on the line, and taking that is just part of the job. But I think there's also with the proverbial weekend warriors, the guys who still like to work out, or just people who occasionally their shoulder does flare up. They go to the doctor and they're like, "Yeah, cortisone shot, you'll be fine." Um, what are your thoughts on those?
So with cortisone shots or any shots in general, we always have to understand what the reason is. And for most people getting cortisone shots, it's to lower their pain levels, right? Let's take somebody who's having who gets a cortisone shot, their shoulder feels amazing, and It stays amazing. They don't have the pain come back, all those different things. Kudos to them, double thumbs up. Majority of people, this is what happens though. They get the cortisone shot, they feel like Superman for a couple weeks or potentially spread out over a couple months, but because they don't change any of their patterns with how they're moving, how they're training, how they're taking care of their body, the inflammation comes back over and over. I think a lot of healthcare, we're very much more playing defense on things. This happens, let's react and do different parts here. What I wish healthcare would turn into, why is this individual having that inflammation in the first place? Is it even a shoulder issue? Is it something more with their nutrition? Is it their stress levels? Did something happen in their life that a family member passed away? Did they lose their job? There's so many other factors that can go into pain, and I think telling someone that they can just get a cortisone shot and it's going to magically fix their symptoms is a band-aid on itself.
I love that approach. Um, I would have enjoyed that growing up, playing sports, because none of the other ancillary things were ever brought up. It was always, let's mute the pain that you're in and follow some basic things to fix it and check back in a few weeks type of a thing.
Yeah.
Um, and that has me think about rotator cuff tears,
Mm-hmm.
because I've heard quite a few times that people can tear a rotator cuff and may not know it. I had a good friend who tore a rotator cuff, and his doctor said, the osteo said that odds are his other rotator cuff is torn too, if he's feeling any pain in it. So it's weird to me that people can have tears or partial tears and walk around not maybe knowing. So, from where you sit, do rotator cuff tears always require surgery? Um, yeah, what are your thoughts on that?
I'm going to break down this in a couple different ways. Number one, 67-70% of the population will experience shoulder pain at some point in their life. So number one, shoulder pain is a top disability. The other thing is rotator cuff tears. A lot of people don't even know what the rotator cuff is. So let me take a step back and explain what the rotator cuff is. We have our shoulder blade or our scapula on our back, and obviously we have our shoulder. The rotator cuff has four muscles that attach that shoulder blade to the shoulder. When somebody has a quote unquote tear, it's often not just from one instance, unless they fell or they caught something heavy as it was coming down. But a majority of rotator cuff tears are more chronic in nature. Now, to go a little bit level deeper, 50% of the population around age 60 is walking around with a rotator cuff tear. Out of that, 40 to 50% of those people are asymptomatic. They do not have any pain or any limitations. So what people have is they're living a healthy life. They tweak their shoulder, they go into the doctor, they get an MRI, and they get slapped up here with a rotator cuff tear. The reality is that tear was probably there before they lifted heavy or did anything else to get there.
That's crazy to think that there's that many people struggling with it and that they're asymptomatic. They just don't even know it.
Yeah, and like to touch on like the surgery kind of component with it, a lot of times, for example, all right, I'm going to share this with you here. I had a guy named Todd this morning who's 5.5 months out of rotator cuff surgery. He had all four repaired. That is not a very common thing. Typically, it's going to be more the supraspinatus and the infraspinatus. But this guy had all four of these things. He's still going to physical therapy. When we did our assessments here, I asked him to take his shirt off to look at what he was doing overhead. His mechanics were all jacked up. His shoulder blade wasn't moving, his shoulder was not dropping, and his trap was shrugging like crazy. So a lot of people think, oh, I have this pain, I'm going to get the rotator cuff surgery, and all of my pain and everything is going to go away. That is not often the case. And with this individual, he had significantly less pain, significantly less limitations when he had all four of those rotator cuffs torn than where he's at 5.5 months after surgery. A lot of other people, too, they have this shoulder pain because other areas for the root cause were not addressed by like screening and rehab. They get the surgery, but they're still having the pain because they're either having a nerve referral or some other tissues are being impacted to why they're having that pain in the first place. With exercise, you can always take a step back and plug and chug different exercises. When you go under the knife, there's no going back. Your anatomy is now changed, and you're basically stuck with whatever the outcome is, and you're risking infection or whether or not they're even doing the surgery to address the root cause.
So if somebody is sitting listening to this and they're kind of grabbing their shoulder and thinking, gosh, I wonder if I have something going on, can you maybe just demonstrate one or two quick tests that somebody could do right now, sitting here watching this, to figure out, I might have something pretty major going on and need to reach out to Dr. Joey or, a different physical therapist, what have you?
If you're watching this and you raise your arm above your head and you cannot control it on the way down, that's a red flag. If you are going throughout the day and you go to shake somebody's hand or you go to open up a jar and you are having sharp stabbing pain, that is not normal. As far as like testing with it, I tell people all the time, like, it's just a matter of putting your shoulder in different parts. So for us, when we're screening, number one, we do a median nerve tension test here. So this would be a good one to kind of chat through. And I'll kind of demonstrate this to the best of my ability. And what it looks like, you bring your arm out to the side into a waiter position. You extend the elbow, wrist, and fingers down, and you hold it there. And you take into account anything that you're experiencing, whether there's tightness, whether there's pain, or anything that's referring. Then you come back out of the position and go into it one more time. While you're holding it with your elbow, wrist, and fingers pointed down, you bring your ear to your opposite shoulder. If that increases what you are experiencing in the shoulder or any of those other different spots, you're likely not just dealing with a shoulder issue. And that's a majority of the stuff that we see on our shoulder assessments, and about 70-75% of people that are dealing with nerve tension.
That's crazy. That's crazy. So, muscle tightness, because I think you'd mentioned this gentleman that you met with earlier today,
Yeah,
where shoulder blade was basically staying fixed.
yeah,
And it sounds to me like other muscles were trying to compensate for that lack of mobility. So his traps were getting really tight.
yeah,
Sometimes I would imagine there's people who have tightness in their traps, maybe tightness under their armpit, their lats, their latissimus dorsi, etc. And they think, oh, I'm just really tight. I should go get a massage. Um, what would you say to somebody who maybe feels tightness there? Is that a symptom that there could be some other issue going on? How do we know when it's just regular muscle tightness or we have bad biomechanics?
Well, the nice thing about the shoulder is you have two of them, right? So if you're feeling difference in tightness on one side versus the other, as opposed to just stretching and getting soft tissue work, I want to know why there's tightness in the first place. You hit the hammer on the nail. The three most common areas that we see for people that reach out that have tightness are going to be in the trap, the lat, and the pec muscle. And I'm going to explain why. If somebody is having chronic shoulder pain, this is the phenomenon that happens. Let me ask you this, Justin. If you were to put your hand on a hot stove, what would you do with your hand?
Pull it right back.
Exactly, because you're experiencing that pain. The same thing happens when someone's experiencing shoulder issues. They've had pain reaching back, grabbing something out of the car, or going overhead. So their body's way of protecting it is to tighten up so you are less likely to move into those positions with it. And that's where a lot of people fall under this trap. If you do soft tissue work and you get a window where that tightness decreases and goes away, but when you go to bed and wake up, your body keeps on hitting this reset button. The reason being is the muscle tightness is a symptom, and there's a different root cause that's causing it to become tight. That's where you have to focus on and address your efforts.
All right. So I've seen your videos on TikTok, which, by the way, I love. That was part of the reason I reached out because I was like, he makes sense. He cuts through the noise. I would work with him. Um, but I think one of the things that I would imagine in your profession in this social media culture and in this culture of just quick fixes
Yeah.
is maybe somebody sees a few videos, they go to YouTube, whatever, and they find some program and they just follow it. What are some of the biggest mistakes that people make when trying to rehab their shoulder on their own?
Good question. Number one is knowing where to start. The guy on YouTube that you're seeing these exercises for, what is the purpose? Is it for rotator cuff strengthening? Is it to improve how the shoulder blade drops in the socket and moves up and around? What a lot of people do is they'll try different exercises and it almost feels like it's a teeter totter. They're not sure what's working or what's actually inhibiting them from getting to that next step. The other thing is they try different things, but they're not sure what's next. It's the same thing of like putting a puzzle together. You have all these puzzle pieces, but you don't have your specific puzzle map to go off of. So if you're putting different parts together, you could be making some progress, but then the shoulder starts to plateau because you're only doing shoulder specific exercises. Where we like to come in, and I believe that all healthcare should do this, is providing an individualized puzzle map to go off of, and then also introducing new puzzle pieces that people aren't often seeing that can be directed to what they have going on and what their specific goals are. And that level of individualization is not something you're going to pick up on YouTube, reading a blog, or checking out Instagram videos.
Okay. So I'll remember that when trying to, there's some fitness influencer doing some cool movement or something that, yeah. Um, so let's say that I or somebody listening to this is doing a bench press and feels a tweak or reaches behind them in the car. Their kid drops something and they're driving and trying to grab something. And they feel, just kind of that like twinge. What should somebody do immediately after if they are worried that they might have hurt themselves?
Number one, take a deep breath and breathe. A lot of times when people experience pain, they ramp up their nervous system even more. They're worried of the oh snap moment. Did I do this? Did I do that? They go on Google, they go on YouTube University, and they start searching for all the symptoms. So, the number one thing, step back and breathe. Acknowledge the fact that you might have tweaked something or strained it. Not the end of the world, similar to spraining an ankle. Everyone's probably always done it in their lifetime. The next thing is to do gentle movement and get blood flow to the shoulder. So that bench press, let's take the bench press for example. Let's say we're lifting heavy and we feel like a little bit of like a pop or a strain. What I would tell somebody is to walk around and keep it mobilized. Try some different exercises and maybe stop the bench press for that day, but continue to try working out and getting blood flow. The key indicator is how do you respond that night and the next day. A tweak for a lot of people can recover in a couple of days if it truly is just a muscle strain. If it's something that lingers and it's going on for weeks, going on for months, and it's not getting better, I would tell someone to go to a provider and get it looked at.
Okay. So let's say that I had hurt my shoulder and
Yeah.
I am sitting there with my arm mobilized, right? I'm worried about hurting it, and I want to speed up shoulder recovery. Like, what are three movements or habits outside of just maybe like moving it around a little bit that you would recommend people do?
I would get movement at the shoulder, but also above and also below. Number one exercise that I would prescribe would be a wall slide. You head over to the wall, you put your hands on the wall, you slide your arms up, and you lean your chest forward at the top. It's getting thoracic extension to open up your upper back. It's teaching the shoulder blades to move up and around, and it's getting the shoulder comfortable again in the overhead position. Second thing I would do, I would start to address the neck. I would be doing an exercise that is a chin retraction and an extension. Couple different reasons. Number one, we're improving how the neck is able to get into positions and freeing up any tension or guarding that we might be getting in the traps. Number two, we are opening up the space for the nerves as they exit the neck and refer into the shoulder. This can often calm people down when they're more in that sympathetic fight or flight state. The last thing that I would do would be something simple such as a bench opener. Putting your hands on a bench, you could either hold a PVC pipe with your palms facing up and on your hands and knees. From this position, you're dropping your chest down and bringing your hips back. This is going to open up the chest, the lats, and make the shoulders feel more in a relaxed state. Those are the three things that I would start with.
Okay, great tips. Great tips. So for most people who lift or play sports or just want to stay strong, um, especially as people get into their 50s, 60s, 70s, and beyond, how do we build resilient shoulders that are durable and last?
Good question. So, number one, you can't just chase the strength. You have to chase the control in different positions here. So, what I mean by that, when we're working with a client, we have to build the foundation. The foundation is improving how somebody moves and improving the mobility boxes and then decreasing the pain. Now that the foundation's built, it's a matter of stacking onto that foundation, putting someone's shoulder in more of those vulnerable positions. For us, we really don't overcomplicate it because the shoulder's a ball and socket joint. It has to get in every position. So that's going to be training it overhead. It's going to be training it into extension. It's going to get comfortable in that internal rotation at the bottom of a dip or a bench press. It's going to be reaching out to the side, and it's going to be training full rotation control into external rotation and internal rotation. So for us, what we do from a programming standpoint and tell someone that we're going to bulletproof it, we just expose them to as many different positions as possible with as many different stimuluses as much as they can take that allows the shoulder to recover. That's what builds that baseline for them for the long term.
Okay, so this might be a redundant question, but it's one I tried to pose a few questions to people to see, okay, I'm going to be meeting with Dr. Joey, like what questions do you have? And one of them kind of similar to this, but basically what's if there was one exercise that you could recommend to people almost ad nauseum that they could use and be okay with, but that would help if they could master it, would help them with shoulder longevity, what would that one exercise be?
Wall slide. Wall slide, because basically what this is doing, it's bringing the shoulder blades, and the thoracic spine together with it. It's an exercise that you are not going to overdo. Out of all my years of treating shoulder issues, I've had one guy who overdid it. And the reason that he overdid it is because he loved it so much and it was helping his shoulders that he kept on doing it in the same place in his house that he actually chipped the paint off his wall. And his wife told him that he couldn't do them in those areas with it. But hands down, the wall slide is one of our favorite exercises that we're providing for a lot of our clients early on.
Okay, all right. um, Bench press has been brought up a few times in this conversation, and I think stereotypically a flat bench is kind of known amongst gym bros or even just guys who worked out in high school, or just, you always hear that the flat bench press is something that damages shoulders over time. If you could send every gym in America a sign to place above the bench press that said one thing, what would yours say?
Mm. If your shoulder doesn't feel safe, it will never get strong. I'm going to tie this back to our guy Tom here, who hit the bench press world record. When we started with him, his shoulder was not comfortable at the bottom position. When we talk about putting your hand on a hot stove, you pull your hand away to protect it. In traditional physical therapy, we put people through these positions in these little strength tests, right? Hold your arm out here, go out to the side, and people are told that their shoulder is weak and they need to do banded rotator cuff exercises. The reality is they're having pain getting into those positions, and that is why it's showing up as weakness. The same reason that you wouldn't keep your hand on the hot stove. So for Tom, the number one thing that we did is we trained his shoulder's ability to fully get into extension and internal rotation at the bottom. We did banded mobilizations, we did scap work, and we cleared up that shoulder extension. By us doing that and simply allowing his shoulder to get into a better position, in the first month, he put 50 pounds on his bench press. And he reached out to me. He's like, I'm getting so much stronger. I'm like, brother, you are not getting that much stronger that much quicker. The reason is you're now able to get into those positions and now actually turn on the right muscles to activate through the pushing pattern. That's the biggest thing, hands down, for people that reach out with shoulder pain with bench press. They do not own the ability to extend and internally rotate well at the bottom.
Is that where you think a lot of the issues ultimately stem from? Not because I've heard things from pec tightness to your elbows flaring out. Does a lot of it just come down to being in a vulnerable position where all of a sudden the shoulder doesn't have that control? I may be like oversimplifying the question, but
100%. I'll ping it back to you. Besides a bench press or a dip, can you think of any other time that you're putting or in a push up? Can you think of any other time that you're putting yourself in that position and loading it in that way?
no.
There you go. It's the same thing. If you want to improve a certain movement, a certain lift, a certain activity, you need to be specific in how you're training it to match up with that stimulus.
Okay. Okay. Thank you for that.
Of course.
Um, I have a few rapid fire questions if you're okay with it.
Yeah, hit me with.
Um, these are things that were kind of crowdsourced, but I thought it'd be fun to just sort of throw them at you and just see, hey, like what's your hot take? So, most underrated shoulder exercise.
I'm gonna sound like a broken record. Wall slide.
Wall slide. Okay. Most overrated shoulder exercise.
Most overrated shoulder exercise from like a rehab side of things, or like in
Just
one.
yeah, just one that you're like, I don't. There's no need for people to do it like this, or I don't know, just one that you feel like, man, it not really needed.
Mm, it's a tough one. I love all different kind of shoulder movements. I think. Oh, here you go. Banded external rotation. That is my number one overrated tool here. Everyone freaking gets it that has shoulder pain, and 99% of people don't need it.
Love it. Okay, okay, that's a good one. So, most overrated rehab tool, banded external rotation excluded.
I would say like a massage gun. Anything where you're just like putting on to give somebody a different stimulus and give them a tiny window where they have better mobility, and then it just goes right back to baseline.
Okay, it's like a Theragun.
Yeah.
No, yeah, okay. Um, Biggest myth around rehab.
Pain that you're experiencing is damage to the shoulder. There are so many different factors that impact somebody's pain level. If we're telling people to avoid certain activities, we're very much hindering their life and how their body's ability to recover to those different activities.
What about in your life, your favorite personal recovery ritual? What do you do if you're feeling tightness, soreness, whatever? What's your favorite ritual?
Honestly, for me, I do a crap ton of walking. In between calls, I have a walking treadmill. I put this up here, and I get anywhere from 20 to 25,000 steps every single day. For me, I very much, if I am moving and I'm getting blood flow to everything, cognitively I'm stronger. Mentally, I feel a lot better, and I feel like I'm more present like throughout the day with it. So for me, very much it's walking.
Okay, so I'm gonna blame if this podcast sucks, I'm just gonna blame it on the fact that I'm sitting here and just not walking and being better, sharper mentally. Love it. Um, Bad habits. What's one bad habit that you wish patients would drop immediately?
I think it's like a twofold. I think people, if you have pain, it doesn't mean that you're doing something wrong. Try to modify it. I very much put the ball in people's court with this. I have pain with this. Okay. How would you modify it? Well, maybe I shouldn't do as much weight. Great. Try it. How does that feel? It feels better. Yeah, it hurts when my elbow's out to the side. Great. How would you modify it? Well, if I bring my elbow in, it feels better. Great. So putting autonomy on the person in front. So the biggest thing for people to drop is if you're having pain, figure out a way that you can modify and still be active, and then come back to that over and over and keep retesting.
All right. So we're coming up on the end. But if you have time, I have a couple more questions.
Yeah, absolutely.
um, Actually, a few that have come up. So if you could have everyone listening to this understand one truth about pain and healing, what would it be?
One truth about healing. Healing is not about doing more. It's about restoring trust in your movement. Meaning, you should be having confidence in the ability to get into various positions and stay active with it. I had a mentor tell me this one time when I was in physical therapy school. The day somebody stops squatting, or it's like the day that you don't squat is the day that is one day closer to never squatting again. You put somebody in a wheelchair and they go to a nursing home or something like that and they're on a recovery side of things, if they do not get up and walk and to do those different parts, they're going to be confined to that wheelchair for the rest of their life. And I feel like a lot of people, not necessarily from the wheelchair side of things, do the same thing with their life. I have a bad shoulder, therefore I can't do X activity. Something that we always want to squash when people reach out to us.
Yeah, like if you don't use it, you lose it. And
Exactly.
okay. Um, what do you see as the future of physical therapy? I mean, you're coming in with, I think, this really refreshing approach, which is let's look at all of the issues that could be causing this, not even necessarily directly the shoulder pain, but is it, I've heard you mention inflammation, sleep, stress, etc. Um, where do you see the future of physical therapy going, or where do you hope it goes when it comes to your viewpoint on health, wellness, and healing?
I'm traditionally more of an optimist, but the more stuff that I'm seeing with reimbursement rates dropping lower and lower for insurance, PT mills just coming more and more, the amount of new grads that are coming out and just getting more and more jobs in the PT profession and them having to see anywhere from 20 to 40 clients a day, unless something changes, I don't see the physical therapy like realm doing too hot. What I see is going to be more people doing what I'm doing, taking an online approach, building customized programs. You know, we discussed a little bit earlier, right, about like the functional med kind of world, right? Like there's people that pop up different practices and they go outside the norm. I think that the physical therapy world is going to be going the same path that it has been, but you are going to have those people that are branching off and doing their own specific parts. And those are the people that are going to provide the best relief and best results for anyone that reaches out.
What's your take on, you mentioned functional medicine, but like, what's your take on overall health and wellness? Do you ever give your patients advice regarding how they eat, sleep, etc.? Do you have any tried and true principles that you feel have served you really well?
Yes, and I'm gonna give a quick story about a functional med doc out here in Denver. When I moved to Denver, I had this patient, and this is when I was working in person. I had this patient who had this big toe fusion. Never seen it before, but I worked with him on his back. He's like, you got to help me. And I'm working with this guy for a month, and it is just not taking. It is not going. And I was at a networking event, and there was a functional med doctor, and Dr. Glenn Harrison, guy's a rock star. He told me, and he's like, "What's his vitamin D level?" I'm like, I have no idea. I don't even know if they're checking that with it. He's like, okay. A couple weeks go by. I send this individual to Dr. Harrison. He not only called the vitamin D levels, but also found other problems that this individual was having from chronic migraines over the last 30 years. Not only were we able to get his toe back to normal and he was back to flying planes, he got off medication that he was on for the last 30 years from headaches. So where I'm getting at with this is I think everything is so important. Oftentimes when you go to physical therapy or like a chiropractor, they're not asking about other lifestyle factors. If somebody's drinking 12 beers every night and wondering why their shoulder hurts, let's not maybe jump to shoulder exercises. Let's try to clean up some of the inflammatory things with it. That's very much our approach. If somebody has a flare up, I ask them, did you eat anything that you typically don't? Did you have more margaritas and more drinks than you typically do? Or did you have any other stressors in your life that have popped up? Majority of the times, it's usually something like this that's exacerbating their symptoms. That's what I would say.
That's awesome. And it's nuts that you could ask that and start to find things that possibly aren't even necessarily starting at the shoulder, but way more upstream than that. Um,
Yeah,
so
100%.
if someone's listening to this and they're when they sleep, they wake up due to pain, or when they work out certain movements, they stay away from. My dad has stayed away from certain movements because it just aggravates and he doesn't feel safe doing it. What is one small thing that listeners or viewers can do today to feel better tomorrow?
Focus on movements that feel good and don't be afraid to test the boundaries with some of those other ones. So if you take your dad, for example, and he has pain going overhead or reaching back, what I would tell him is to work up into the range and kiss the pain. What that means is if he's having pain right going out to the side there, he needs to mobilize the shoulder and stop right before he has the pain and get his shoulder more comfortable to it. Because I have another patient story here. This is Sandy, the sweetest woman in the world. They wanted to replace her shoulder for 10 years. She said no. She had bone spurs. She had all these different things in here. And her goals were simple. She wanted to be able to lift her arm above her head. So we started with this. It got higher. It got higher. And the wins that she had, turning off the light switch with her shoulder and being able to do that stuff. Then it was reaching to get the mail and not having to get out of her car and actually being able to reach out to the side. And then my favorite one, this was a couple years ago, being able to pour the gravy on her mashed potatoes at Thanksgiving. It's the little things in life that maybe somebody thinks that they're not going to be able to get back to. But if you start and you move in the right direction, you can check a lot of those boxes again.
That's awesome. And I would imagine a lot of people listening to this, we all struggle. I mean, so many people struggle with shoulder pain or have or know
Yeah.
somebody that does. And maybe they've heard some of this and they want to follow you on social media, or they actually just want to connect with you and get personalized help. How do people find you? How do people get in touch with you and get their movement and lack of pain and all that stuff? How do they get their lives back?
Yeah, so number one, Instagram is probably our biggest channel that we have. We have over 90,000 followers on there. So that's just going to be at shoulder.comeback. Our YouTube channel is going to be Comeback Performance. And then our website is comebackperformancept.com. We have over 130, 140 blog articles for people to check out. We have different videos and a lot of different parts. And if they want to reach out and, like, if they've listened to this podcast, if they can mention your name as well, we can give them a specific shoulder training that's going over the big 5 areas that'll really start to get them moving in the right direction.
Awesome. Awesome. I'll make sure I have that in the description for anybody that wants to check it out. Before we go, Dr. Joey, any final words of wisdom, anything we didn't cover that you want to get off your heart, or do you feel like we pretty much covered the bulk of it?
I feel pretty good. I feel like we've covered a lot of different things. The biggest thing is don't be afraid to move, right? Just because you're experiencing pain doesn't mean that it's permanent. And reach out to somebody that you know is going to be able to help you. I feel like so many people get stuck and they feel like they're just going to do everything on their own. One of the best things that you can do is to invest in someone that's going to help hold your hand and guide you across that finish line. That's my best advice.
Awesome. And great advice to end on. So I appreciate your time, and look forward to hopefully talking again soon down the road.
Awesome. Thanks for having me, Justin.
Thanks a lot, Joey.
Cool.
All right, hang on one sec.